Ready? Hi, how are you guys today? We're a little late on our live show, but that's okay because maybe you're going to watch it later on. We have some exciting news. This is Claudia, and she is our nurse practitioner that just started with us about a month ago, and this is called Trial by Fire. She's going to inject me with Botox. And so she's done a couple patients already, but she's that good that I trust her 100% to do this. And you can see all the little dots on my face. We've already discussed my treatment plan. I'm about a week early, but I'm moving so much. So we are very excited to have her do this. And I am very confident, 100% confident, or I would not be sitting in this chair. So I wanted to introduce you to her. She will be ready to start doing her own Botox very soon. And so that's why we wanted to get her on camera doing mine. If I trust her, you should trust her, right?
Of course.
Yes. So, okay. Are you ready?
Let's do it.
Okay. So beforehand we decided, go ahead, yep, grab your stuff. So beforehand we went through all my treatment plan, and usually in the glabella region we do 5 injection points. But because I've been doing Botox for 14 years now, I think, we're only doing 3 injection points. So the beauty of Botox is that there are so many different ways to do it. It's an art to be able to figure out exactly. Now, there are standards and there are regular amounts that we do, but when you've done it for so long, or if you're brand new and you're much younger than I am, you're going to do less Botox. So there are ranges that we do, and when you come in to do Botox with us, we have a great video that explains everything to you. Or if you want to watch it, it's on our website. So you can go on there, and I think it's on our Botox page, but you can go on there and you can watch how we do Botox, why we do Botox, and it explains everything beautifully. So, okay, you ready, Freddie?
Let's do it.
Okay. So, I wanted to tell you, so last Friday, I got my lips done. So we are going to take some before and afters and show the difference. But I wanted to show here that I have a little bit of bruise because I did a little bit in my cheeks, and that's normal. And I probably will bruise with my Botox. I am a bruiser. There's just no getting around it. So that's one of the things that can happen. So you just have to be prepared for that. The bruising, actually, I had some bruising down here, and it's all gone. So really, it's just this little area, and I've got a little here. So, okay.
All right.
Okay.
Ready?
So, Steph, I'm going to hold the mirror up so you might, yeah, there you go. I am ready.
Okay.
Okay.
Here we go.
Excellent. Barely felt it.
Do you want ice on the other?
I should be okay here. We're going to ice a little as we go just because of the bruising that I have, so it should be fine. Okay, ready? Nice. Okay.
Now I'm going to come to the other side. Sorry, Steph, because the mirror's in my way.
And so you can see just the little bubbles. Those will go away in about 5 minutes. We mix Botox with normal saline, and so that's why it is, you can see that. And remember, I'm like super sensitive and everything seems to be, are you good?
Uh-huh.
Okay. Okay, very good. So not bad at all. Good job. I'm not crying. And I'm a baby. You know, you've heard all week how much of a baby I am. Okay, that was actually extremely painless. That was awesome. Okay, so where are we going now?
We'll go ahead and do your forehead.
Okay.
Which I just want to make sure that.
Yeah, and I should be okay since, you know, I don't think we need to ice there. We'll just mainly ice the crow's feet, so.
Okay.
Okay.
When you treat the forehead, what lines is the concern, so people know?
So look at, I mean, I've got lines, you know, everywhere. I need a smooth forehead. Like, this drives me crazy. So what she's going to do, you can even see I've got little lines on the outer edges here. So what she's going to do, as you can see, we're going to go straight across my forehead. But I have lines up here, and because I've done Botox so many times, I know that going straight across is not going to get these guys. So I go ahead and inject up here as well. And then because these guys are on the edge of my brows, she's going to inject a lateral brow lift, and that'll also help those lines. Okay?
All right.
Okay, so I actually can watch this one if you need me, but if you don't, I'm
Do
good.
you want ice on the forehead?
No,
No?
no, I'm good.
Okay.
So I'll let you do it.
All right.
Okay. And I'm just going to make sure. Yeah, you're doing great. I tell you what, I'm not going to say anything.
Don't jinx it.
No. I felt that one a little bit. The other two I didn't feel at all. That's what I was going to say.
Oh. See? Jinxing.
Nice.
Okay.
Okay.
Let me...
Looks good. Okay, so then she's going to go right at the top.
I think we're one short
That's okay.
on that one.
What we'll do is we'll pull up and another one.
Okay.
Oh, you're too short?
Yeah.
Oh, two. Okay.
Short.
Nope. So just pull it in one of like that. This.
This one here?
Yeah.
Okay.
So when we're looking at crow's feet, we're looking right at these guys here, and so you can see the little injection points that she's going to go. I mean, I definitely have my lines, but they're not as bad as what they usually are. A lot of times, especially if I don't stay on top of it, which hello, I do. But the lines come all the way down my face usually, and I don't like that. I don't like any lines. So they're really not that bad. Okay, so now we're doing crow's feet.
I need to do the other
Oh.
two in your...
Oh, up there.
Here,
Okay,
and
yeah,
then
sorry.
We'll do crow's feet.
Okay.
Go ahead and turn a little bit toward me. Perfect.
Okie dokie.
And we'll
Okay.
Go ahead and do...
Do you want to do the lateral? Is that what we're doing?
I've got the...
Yeah, so then we'll do lateral and then chin, right?
Okay.
Okay, so got it? Okay, so when we're looking at lateral brow lift, what I do is I wink, and then you can also lift up, but these lines are not as bad as these lines. So, okay.
We're doing one or two?
You should be able to do two.
Two.
You should be at 14. You're at 15. That's okay.
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 Okay. Do the other side. Good. And, this is taking a little longer just because she's new at it. Usually it takes, 5 minutes to get it, but I want you to go slow. So, okay, so chin now.
Okay.
Okay, so squeeze hard. I don't really like the chin. Nobody ever complains about this but me, so squeeze really hard for me.
All right.
Ew.
Sorry. All right, there's one.
See? I don't know why I'm so sensitive down here. Squeeze harder.
I'm going to use my nails.
There we go.
All right.
That one wasn't as bad, so good.
Okay.
Okay, so now this time we are going to ice only because I've got the bruising already. So go ahead and ice right here. So the ice helps to shrink the blood vessels, but it also helps to numb it up just a little bit. So if you really are really concerned, we don't ever put topical on or anything, but the ice can numb it some. So, oops, you know what? Can you get that, please?
I didn't even see.
That's all right. And I can hold it if you feel. Okay. Okay. Ready?
All right. And then 24.
Yep, so you're going to do 4. Okay, so,
You want ice more?
yep.
Okay.
Just get the next spot. So I'll let you hold it so you're in the right spot.
All right.
And again, this is mainly just because of the bruising. I mean, if I bruise, I bruise a little more, but trying to prevent a little bit more. Okay. good.
Am I good on that side?
Okay, awesome. That didn't hurt. Okay, looks good. Okay, moving on. And see, look, these are almost gone. So that just shows you, and so when you have Botox, and you can usually just, we can put a little bit of makeup on, but usually you just walk on out and you can't tell you had anything done. But yeah, you can definitely see my bruising.
Let me know when that feels good.
You could probably leave it forever. No, it's probably fine.
Okay.
Okay, so this one you're going to go up a little bit above. Is that what you're doing? Okay. Let me tell you how good she did. I could barely feel it, so that's awesome. So, Miss Claudia, nurse practitioner, is here with us at Ooh La La now, and she has a little bit more training, and that's really the point of this. Is I wanted to show you how I train my providers, because it's extremely important to me to have people who I trust, because then I know that you will trust them. But I train them exactly how I would inject you. And it just gives you a little bit more freedom of when you can come in, because thankfully we are super busy, and it is a little bit to get in to see me. So that's why we're getting Miss Claudia going. So if you have any questions, anything you want to ask us or come in for a consultation, please do. And she'll be up and running in the next few weeks, I think. So give us a call at 618-288-9117. Thanks for watching.